Hello everyone, thank you for joining us for Foresight. So coronavirus has been with us for about 8 months now, and now we're at a position where we can finally reflect. We know a bit more now to share some of the lessons that we have learned, and also we're more knowledgeable about factors that have contributed to how different countries have performed in controlling the pandemic. So essentially this is what this presentation is about. And for the next few minutes, we will just be exploring the different experiences across countries and try to connect the dots as to why different countries had such different experience, and also looking at countries that have relatively similar social norms but had vastly different experiences too. And then what effects did non-pharmaceutical interventions have in alleviating or trying to reduce the impact of the pandemic? We're also going to look at developing versus developed countries, and also what impact this pandemic had on their economy. So we have seen similar performances in countries that are within neighboring regions. For example, the European countries like Spain, UK, and Italy, they all saw amongst the highest COVID-19 deaths per million. And this was followed by Italy, Brazil and USA, who had also similar deaths per million. The Asian countries had amongst the lowest deaths per million, and we will explore this in more detail later on. But what was more interesting to note is how the Nordic region, so this consists of Denmark, Finland, Norway, and Sweden, they all had similar experiences except for Sweden, who saw amongst the highest deaths per million. So there are similarities within countries in the Nordic region, except that maybe Finland has the oldest average age or higher pension ratio to the rest. And we could have expected that because of this, they might have been more affected by the crisis. But as it turns out, it's a country's response measure to the pandemic with respect to lockdown and testing strategies that have made the most difference. So Denmark, Norway, and Finland, they all implemented very stringent measures with regards to lockdown and closing their borders, whereas Sweden, they conversely had a relatively easygoing approach, and they just, for the longest time, enforced social distancing. So having a look at the trajectory of Sweden, many of the cases initially in the beginning of March were as a result of international travel, so cases that were imported. And this happened to coincide with the widespread outbreak that was happening in Italy at this time. Because of this, it spread rapidly within the rest of the country to domestic residents and also healthcare workers. So just summarizing the whole ordeal in Sweden, when comparing to Nordic countries, it had a lot to do with how they responded to the crisis. So these are just a summary of some of the lockdown measures that each country implemented. So Denmark, Finland, and Norway, they all had stringent measures and earlier on in the pandemic, and enforced measures regarding international travel, quarantine, social distancing, and also restricting public gathering. Sweden, on the other hand, all of this was just a recommendation until late March. By then, as you can see by the all-cause mortality, that the virus was already widespread in Italy, in Sweden, that although some of the interventions may have made a difference in other countries, it would not take back the infections that Sweden had already encountered. So apart from Sweden being too slow to respond to the pandemic, there are other possible reasons for how the experience differed, like the fact that Sweden is home to more migrant workers than the other countries, where a relatively large proportion of them work in elderly care or nursing homes with people that are most vulnerable to the virus. So the fight against COVID-19 has resulted in many countries being unsuccessful the first time around, resulting in a resurgence of infections after a certain period. So amongst others, a second wave has been evident in Israel and Luxembourg, but it's also worth mentioning countries who are possibly experiencing a second wave, like Spain, Croatia, and Netherlands. So Israel, they were successful the first time around as they enforced strict lockdown measures. But after the earliest sign that cases might be reducing, the Prime Minister declared an early victory and relaxed restrictions in May. And he's even quoted advising everyone to go out and have beer and have coffee and have a good time. And shortly after, Israel then faced a resurgence of those infections, but actually more aggressive than the first one. Luxembourg is also a country who relaxed restrictions a bit too quickly, and this promoted a lot of movement within their population. So mostly a lot of focus is on the measures that a government takes and how they respond to the crisis. But more importantly is also how people comply and respond to the restrictions that the government set. And this is possibly one of the reasons behind Spain seeing a second wave. So this graph shows the stringency indices, which were obtained from Oxford University. So the green just shows the strictness of the government lockdown. It's an index from 0 to 100, with 100 being the strictest lockdown. The purple line shows the mobility trends in response to these lockdown measures. So we can see that Spain, who actually saw one of the most stringent lockdowns in Europe, that initially lockdown worked because we see how there's a sharp mobility, there's a sharp decline in mobility in response to it. But after 2 months after the lockdowns were lifted and the virus spread again faster, that the government tried to correct this by reimposing lockdown. But by then, the people no longer responded. And we can see this by the relative steepness in the arrows, so the green and the purple arrow. And it's also worth mentioning that to a large extent, the second wave could be as a result of Spain ramping up testing at the same time that the second wave emerged. So out of interest, I tried to find out who is responsible for a second wave and found that it's mostly amongst infections within the youth, so younger population, who could have possibly been fatigued by the lockdown and did not adhere to any of the measures set by government. And because young people generally are asymptomatic or have very mild symptoms, the second wave is accompanied by relatively fewer deaths than the first wave. So while we're on the subject, specifically for South Africa, it's clear that South Africans hardly waited for restrictions to be eased before they maneuvered around. So this graph was constructed using mobility indices from Google's mobility reports, and we can see how the visits to parks, recreational sites, retail shops, and transport reduced significantly and reaching lows of about 8,000% once lockdown was implemented. And once lockdown levels were eased, these mobility levels returned to much normal levels. So just in summary of the above, that a lot of countries do remain at a risk of a second wave of infections for many combinations of reasons. And I will leave it to you to decide whether you think any of these apply to South Africa, and from that, whether you think South Africa is at risk of a second wave. So firstly, for those of you who still believe that lockdown did make an impact, that government relaxing restrictions as soon as they see first signs of decline in cases allowing travel to resume again. That could have been a possible reason. There has been much debate though about the efficacy of lockdown, particularly in South Africa. And yesterday, Barry made a hypothesis that there is very limited effect in non-pharmaceutical interventions in general. And while I do agree that now possibly lockdown has very limited effect, earlier on, in earlier durations, in those stringency graphs that we saw earlier, we saw that cases actually did respond to stringency in lockdown. And it could have, the efficacy of lockdown could possibly be exaggerated because cases, they respond to many other factors besides lockdown, like testing, for example. So on the subject of testing, many countries could be testing insufficiently earlier on, and then suddenly it decide to enhance their testing to catch up, and then that results in a resurgence of cases leading to a second wave. So a lower first peak and then much more aggressive infections later, like in the case of Israel. Another reason could be citizens becoming very frustrated or fatigued by all the lockdown restrictions, that they no longer want to adhere to the control measures that are set by government. A fourth reason could be the virus spreading to other regions. So not necessarily a second wave, but new infections in new states, like in the case of USA. Another reason could be instances of super spreaders. So people within the population who are transmitting infections to far more people than the majority do. So one may ask why some countries have performed better than others, and how much of this can be attributed to the preparedness of the government. So these are some of the countries who have experienced a pandemic before, SARS in the early 2000s, and this has possibly resulted in their effectiveness against COVID-19 now. So these countries already had plans in place for the next pandemic, like infection control measures, contact tracing, quarantine facilities. They had refurbished their hospitals and also educated their citizens about hygiene practices to follow to protect themselves. Some of these citizens could have also developed some sort of immunity against the virus. So we see Singapore having a slightly different experience compared to the other countries, and this could be because of how rigorous their testing and contact tracing system was, or the fact that they were also home to more migrant workers who live in very densely populated conditions. We see that South Korea and Japan, who are amongst the oldest amongst the Asian countries, they foresee possible waves. And they both did very well to control their first peak. And it could be the fact that many of the people who avoided getting infected the first time are now still susceptible and eventually became infected by the virus. Nevertheless, though, when we compare these figures to the rest of the countries in Europe and in America, the magnitude of infections are relatively small. These are the countries who have been successful in containing the infections in relatively early durations. And it has been a grim journey for some of them, like the UK. They experienced the most deaths in Europe and eventually plunged into a recession. Italy at some point was the epicenter of the pandemic, and they have amongst the oldest population, which could have contributed to the experience, amongst other things, because Germany, who also has a similar age, average age, they did not have such a severe experience. We see Belgium in yellow. They actually avoided a second wave, and to a large extent was due to the compliance of their citizens to the restrictions that were imposed by government. So as we have seen in many parts of the world, COVID-19 infections are declining, and it could also be due to a host of different reasons. So this list is not exhaustive, but I have noticed that countries that experience a significantly large first wave will generally not see a resurgence of infections, maybe because a majority of the population had become infected and perhaps developed some sort of immunity against the virus, and that the remaining population that weren't infected, they were possibly too few to fuel a second wave. Possibly the stringency of a lockdown. So generally, countries that have had earlier and much harsher or stricter lockdowns, like the Asian countries, they have an eventual infection rate or a death toll that is lower than others. There's also been a debate as to whether warmer weathers could be helping to lessen the impact of COVID-19. Conversely, though, warmer weathers do encourage people to go out and about, to go on summer holidays, and generally be less cautious. So as summer looms in South Africa, we will see the impact of this. Another reason that a country appears to be effective is possibly because they are testing inadequately and then underestimating the true infection rate in the population. So this graph shows the latest positivity rates, and I also added daily tests on the x-axis just to provide context, because positivity rate is largely affected or sensitive to testing rate. So the WHO made a recommendation that before a country can lift up its restrictions, they have to have maintained a positivity rate of below 5% for about 14 days. So we see that a number of countries are below this threshold, like UK, Denmark, Russia, who are also testing very extensively at the same time. Countries like Mexico, though, Colombia, India, and even South Africa, who are amongst the worst hit in the world, they have a relatively low testing rate per capita. So these countries are not testing nearly enough for the size of their outbreak and are possibly missing out on many infections. So the general trend that we have seen, with some exceptions, is that countries that have a much higher testing rate generally have a lower positivity rate. This shows the testing rate per capita of countries that have been successful by moving past the peak. And despite this, they still maintain the same testing levels that they had before the peak. So this could imply that until a vaccine is made available, that medical schemes can expect costs due to testing to remain. In South Africa, though, once we moved past the peak, supposedly, our testing rate declined. So this it shows also that testing or the infections that are identified is very sensitive to testing, because we see that once testing declined, infections declined almost immediately. So we analyzed the experience at a provincial level as well, and we can see that Western Cape had reached its peak relatively earlier than the rest of the provinces, and it was said that other provinces would follow the same trajectory as Western Cape just later. But after shifting Western Cape 4 weeks ahead, we can see that countries like Gauteng, which is more densely populated, Free State, and the Eastern Cape all had higher peaks for their size of their population. So these are cases per million. So deaths provide a much clearer measure of the impact of COVID-19 as opposed to confirmed cases, because they are more sensitive to testing protocols. But deaths are also subject to uncertainty, because there is a huge, in some provinces, a big discrepancy between a country's COVID-19 cases and also the excess death, so the benchmark expectation in normal conditions. So these are excess deaths that were obtained from the Medical Research Council. And we can see that the discrepancy is far less for the Western Cape province, where in fact, most recently, COVID-19 deaths have been above excess deaths in the Western Cape. And a large part of this could be because there is a lag that exists between when a death actually occurs and when it is reported. The discrepancy is much larger for provinces in the Northern Cape, Mpumalanga, Limpopo, and the Northwest. And they could have possibly been experiencing some backlog issues or have systems that are a bit less accurate in producing death statistics. So this makes me wonder if there are some deaths that are actually associated with coronavirus that aren't reported that way. So possibly some COVID collateral deaths. And to what extent are COVID deaths being underreported in South Africa? And also, what are some, how much of these deaths are possibly due to indirect effects of COVID-19? So because of people's health deteriorating because of how difficult it was to access healthcare or how reluctant people were to access healthcare during lockdown. So these are some of the factors that have significantly led to the successes and failures of different countries in controlling the pandemic. And one thing that does link high infections and high death toll, in my opinion, is a country's intervention. That they begin earlier enough, and how much were they successful in limiting imported cases? So also, what was the compliance of citizens during lockdown? What is the demographic profile of a country in terms of age, comorbid conditions, which Craig spoke in length about, immunity levels of a population, the population density of a country, and also what is the existing capacity of the healthcare system or the response of the healthcare system to accommodate some of these infections. And lastly, and probably most importantly, is the testing rate of countries and also the accuracy of reporting data.